Question 1. What is the nurse's first action when noticing a patient with signs of anaphylaxis after 4 antibiotic administration? A. Notify the healthcare provider. B. Administer epinephrine per protocol. C. Document the reaction. D. Stop the 4 infusion immediately. Answer. D. Stop the 4 infusion immediately. Question 2. Which task can be delegated to an experienced UAP? A. Assessing the circulation of a limb in a cast. B. Applying a cold compress to a sprained ankle. C. Teaching crutch walking. D. Monitoring for post-op complications. Answer. B. Applying a cold compress to a sprained ankle. Question 3. A patient receiving 4 potassium reports burning at the site. What is the priority action? A. Reassure the patient. B. Slow the infusion rate. C. Check the 4 site for infiltration. D. Flush the 4 with saline. Answer. C. Check the 4 site for infiltration. Question 4. A nurse notices a coworker documenting vital signs that were not actually taken. What is the most appropriate action? A. Ignore the situation unless a problem arises. B. Report the behavior to the charge nurse. C. Confront the coworker privately. D. Ask another nurse to intervene. Answer. B. Report the behavior to the charge nurse. Question 5. Which intervention has the highest priority to prevent falls in a hospitalized elderly patient? A. Providing slippers with rubber soles. B. Educating the patient about fall risks. C. Keeping the call light within reach. D. Placing the bed in the lowest position. Answer. D. Placing the bed in the lowest position. Question 6. A nurse is caring for a confused patient who is trying to remove their NG tube. What is the safest intervention? A. Restrain both arms with soft wrist restraints. B. Administer a sedative. C. Use a sitter for close monitoring. D. Turn off the feeding pump. Answer. C. Use a sitter for close monitoring. Question 7. Which action is appropriate when using a 2-person lift to transfer a patient from bed to wheelchair? A. Have the stronger person lift the legs. B. Position the wheelchair behind the patient. C. Coordinate and count out loud before lifting. D. Lift the patient quickly to reduce effort. Answer. C. Coordinate and count out loud before lifting. Question 8. What is the nurse's best action when a patient questions a new medication? A. Reassure the patient it's safe. B. Verify the order and recheck the medication. C. Ask the patient to try it once. D. Delay the dose until later. Answer. B. Verify the order and recheck the medication. Question 9. Which instruction is essential when teaching a patient about using a walker? A. Keep the elbows straight when walking. B. Step ahead of the walker when moving. C. Advance the walker first, then the legs. D. Use the walker only when tired. Answer. C. Advance the walker first, then the legs. Question 10. A nurse sees water on the floor in the hallway. What should the nurse do? A. Notify housekeeping and walk away. B. Caution others and keep rounding. C. Stay with the spill and call for assistance. D. Place a chair over the wet area. Answer. C. Stay with the spill and call for assistance. Question 11. Which action by a nurse ensures safe medication administration? A. Verifying patient identity with room number. B. Administering all medications at once. C. Comparing the MAR to the medication label 3 times. D. Asking the patient if the medication looks correct. Answer. C. Comparing the MAR to the medication label 3 times. Question 12. What is the nurse's next step after finding a broken bed rail on a patient's bed? A. Put the bed in the lowest position and document. B. Tape the broken part until maintenance arrives. C. Remove the patient from the bed and report the issue. D. Mark the bed as defective and remove it from use. Answer: D. Mark the bed as defective and remove it from use. Question 13. Which observation during a home visit indicates a need for safety intervention? A. Medication stored in a high cabinet. B. Scatter rugs in the hallway. C. Night lights in the bathroom. D. Grab bars installed near the toilet. Answer: B. Scatter rugs in the hallway. Question 14. A nurse observes a post-op patient ambulating unassisted. What is the best action? A. Allow them to continue for independence. B. Supervise them and assess their stability. C. Instruct them to return to bed. D. Apply restraints to prevent falls. Answer: B. Supervise them and assess their stability. Question 15. A nurse is caring for 4 patients. Who is the highest safety priority? A. A patient on bed rest requesting water. B. A diabetic patient with blood sugar of 90 milligrams per deciliter. C. A post-op patient requesting pain meds. D. A patient with new onset confusion. Answer: D. A patient with new onset confusion. Question 16. What is the priority intervention after initiating a transfusion? A. Leave the patient and monitor remotely. B. Reassess vital signs after 1 hour. C. Stay with the patient for the first 15 minutes. D. Increase flow rate to speed completion. Answer: C. Stay with the patient for the first 15 minutes. Question 17. When should a nurse wash hands in a contact precaution room? A. Only before entering the room. B. After removing gloves and before leaving. C. Only when hands are visibly soiled. D. After touching equipment only. Answer: B. After removing gloves and before leaving. Question 18. A new nurse asks how to prevent medication errors. What is the best response? A. Double-check all medications with another nurse. B. Ask the provider to clarify all orders. C. Follow the 5 rights of medication administration. D. Rely on pharmacy labels. Answer: C. Follow the 5 rights of medication administration. Question 19. A patient is placed on fall precautions. Which equipment should the nurse ensure is functioning? A. Sequential compression devices. B. Restraint straps. C. Bed alarm. D. Cooling blanket. Answer: C. Bed alarm. Question 20. Which task should be performed by the RN, not delegated to the UAP? A. Helping a patient to the bathroom. B. Feeding a stable stroke patient. C. Turning a patient every 2 hours. D. Evaluating response to pain medication. Answer: D. Evaluating response to pain medication. Question 21. A patient with impaired mobility is at risk for pressure ulcers. What is the nurse's priority preventive measure? A. Apply lotion to dry skin areas. B. Encourage fluid intake. C. Reposition the patient every 2 hours. D. Offer a high-protein snack. Answer: C. Reposition the patient every 2 hours. Question 22. A nurse enters the wrong room and begins administering oral medications. The patient says, "I don't take these." What should the nurse do next? A. Recheck the MAR and patient identifiers. B. Tell the patient it's likely a new prescription. C. Leave the room and notify the physician. D. Ask the patient to try taking them once. Answer: A. Recheck the MAR and patient identifiers. Question 23. Which safety teaching is most important for a patient using a cane? A. Use the cane on the injured side. B. Move the cane and weak leg together. C. Look down when walking. D. Avoid using stairs. Answer: B. Move the cane and weak leg together. Question 24. A nurse finds an unlabeled syringe in the medication room. What should the nurse do? A. Label the syringe with the drug name and dose. B. Ask other nurses who prepared it. C. Discard the syringe immediately. D. Save it in case it's needed later. Answer. C. Discard the syringe immediately. Question 25. Which task can the RN safely delegate to the UAP? A. Administering a cleansing enema. B. Assessing bowel sounds. C. Teaching ostomy care. D. Evaluating skin integrity. Answer. A. Administering a cleansing enema. Question 26. What is the nurse's responsibility when witnessing a patient sign a surgical consent form? A. Explain the risks of the surgery. B. Ensure the patient is sedated. C. Verify the patient signed voluntarily. D. Confirm the type of anesthesia. Answer. C. Verify the patient signed voluntarily. Question 27. A nurse receives a phone order from a physician. What is the safest way to complete the order? A. Write the order and sign the physician's name. B. Record the order and wait for verification. C. Write the order and have another nurse co-sign. D. Read the order back to the physician for confirmation. Answer. D. Read the order back to the physician for confirmation. Question 28. Which action by a new nurse indicates a need for further teaching about infection control? A. Wearing gloves for oral care. B. Using alcohol-based rub after removing gloves. C. Reusing a gown for multiple patients with the same infection. D. Disposing of sharps in a puncture-proof container. Answer. C. Reusing a gown for multiple patients with the same infection. Question 29. What is the priority nursing action if a patient begins to choke while eating? A. Offer water to assist swallowing. B. Call for the rapid response team. C. Encourage the patient to keep coughing. D. Begin back blows immediately. Answer. C. Encourage the patient to keep coughing. Question 30. Which is the most effective method to identify a patient before medication administration? A. Ask the patient their name. B. Verify name and date of birth using the ID band. C. Ask the family member to confirm. D. Match the room number with the March answer. B. Verify name and date of birth using the ID band. Question 31. A nurse notices a newly admitted patient has a wristband indicating a latex allergy. What is the correct safety action? A. Avoid using adhesive dressings. B. Use latex gloves cautiously. C. Notify dietary services. D. Place allergy alert signs at the bedside and door. Answer. D. Place allergy alert signs at the bedside and door. Question 32. Which patient is most at risk for developing hospital-acquired pneumonia? A. A patient recovering from cataract surgery. B. A patient with a leg fracture and traction. C. A ventilated patient in the ICU. D. A patient scheduled for a colonoscopy. Answer. C. A ventilated patient in the ICU. Question 33. What is the most important action before applying physical restraints? A. Obtain a written order from the provider. B. Ask the family for permission. C. Document patient behavior every hour. D. Explain to the patient it is for their comfort. Answer. A. Obtain a written order from the provider. Question 34. Which action best reduces medication errors during handoff communication? A. Let the oncoming nurse read the MAR later. B. Provide a verbal summary without interruptions. C. Use a standardized checklist like SBAR. D. Write important notes on a sticky pad. Answer. C. Use a standardized checklist like SBR. Question 35. What is the nurse's best response if a patient falls but denies injury? A. Return the patient to bed and check later. B. Notify the provider and complete an incident report. C. Do not document unless the patient complains of pain. D. Let the UAP monitor the patient closely. Answer. B. Notify the provider and complete an incident report. Question 36. Which situation requires the nurse to complete an incident report? A. A family member complains about food temperature. B. A patient refuses to take a prescribed medication. C. A patient receives another patient's meal tray. D. A provider cancels a diagnostic test. Answer. C. A patient receives another patient's meal tray. Question 37. What is the nurse's priority when caring for a suicidal patient? A. Allow privacy during personal care. B. Limit visitors to immediate family. C. Remove all sharp and potentially dangerous items. D. Place the patient in a semi-private room. Answer. C. Remove all sharp and potentially dangerous items. Question 38. Which patient condition requires immediate attention by the nurse? A. BP 138 over 88 mmHg in a diabetic patient. B. Sudden change in level of consciousness. C. Mild shortness of breath on exertion. D. Temperature of 99.8 degrees Fahrenheit post-op. Answer. B. Sudden change in level of consciousness. Question 39. What is the safest way to dispose of a used insulin syringe? A. Place it in a regular trash bag. B. Recap and return it to the med cart. C. Drop it in a designated sharps container. D. Break the needle off and discard separately. Answer. C. Drop it in a designated sharps container. Question 40. A nurse observes a coworker slurring speech and staggering during the shift. What is the most appropriate response? A. Ask the nurse if everything is okay. B. Notify the nurse manager immediately. C. Encourage the nurse to take a break. D. Ignore it unless a mistake is made. Answer. B. Notify the nurse manager immediately. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.